Thank you. Obviously, a new open. That sounds like Kevin Gallagher. Nice job, Kevin. And once again, the number, if you'd like to join us, is 877 217 5757. And we have some people waiting in line already to talk with the governor on show number 64. Governor John Bel Edwards has dutifully done this continuously and consecutively for 64 consecutive weeks, not weeks, but months, starting in April of 2016, a few months after he was inaugurated as the 56th governor of Louisiana. And we had him and we lost him and we're getting him back. So there is one line open, I see, if you'd like to make your voice heard. And we appreciate the many stations across Louisiana and some in neighboring states that air this program and have done so for the most part since day one. And we also thank Jerry Mayer of Hometown Productions, who sends this show across the state on cable stations and your television, and many say they watch it on a regular basis. So, again, your number is 877-217-5757, and Matt Doyle, our producer, tells me that we have Governor Edwards back in the studio telephonically. It is the COVID age again, and unfortunately, that's topic number one. And Governor, today, before we get to the numbers, which we know are alarming, the Bessie board got shut down over a mask debate. This is a new world, and we thought we had turned the corner. Obviously, we have not. Your thoughts?
No, we have not, and nobody wants to be where we are today. That includes me, and certainly not anybody who's sick or just lost a loved one, and not the doctors and nurses and respiratory therapists who've been working now nonstop for a year and a half. But at the end of the day, the COVID-19 pandemic continues, and it doesn't just continue. It is worse today than it has ever been in the state of Louisiana, and the numbers in the state of Louisiana are the worst in the country. And so we just have to be realistic about where we are, and it is a public health emergency that is caused by a virus that is very transmissible, more transmissible than ever because of the Delta variant, but it's also deadly. And so mindful of where we are as a state, especially in terms of our hospitalizations, we just have to employ reasonable mitigation measures to slow transmission, to reduce the numbers of people going to the hospital and the number of people dying until we can get more people vaccinated. And clearly the mask mandate to include schools is a big part of that. And virtually the unanimous opinion of public health experts, epidemiologists, infectious disease physicians, and scientists and so forth were behind my reissuance of the mask mandate that today has been in effect for 2 weeks. And quite frankly, with respect to schools, it is the only way that we have a reasonable shot to keep schools open and kids safe. And I would hope that the people of Louisiana would just come to understand that and deal with it and then get past this surge. And I do look forward to the day when we can lift the mask mandate, not just in school, but more broadly. But that day is not today, unfortunately, and we just have to do what is necessary.
Are you perplexed by the number of people who just won't listen? We see these numbers. We see people come and go, some close to us, people we know, people we've heard about. The hospitals are full, and yet some people just will not get vaccinated no matter what.
No, and look, I can't understand that, and I certainly can't explain it. And there is no reasoning with some people, because when you refer to the numbers we're experiencing in Louisiana, well, many people don't believe the numbers. If you talk about the recommendations of the CDC, well, they don't trust that. If you say, well, this is largely caused because we don't have enough people who are vaccinated, well, they don't support vaccinations either. And so if your idea to manage a public health emergency like this is to not embrace vaccinations, not embrace masking or mitigation measures, and to just, refuse to accept any of the numbers, then there is no reasoning with that group. Now, the good, and by the way, I'm being extremely patient, and we're going to keep reaching out to them, and hopefully some or all of them will come around, but they are in the minority. The vast majority of the people of Louisiana do take this seriously. We're seeing a tremendous increase in the number of people vaccinated. It's up more than 400% over the past month, but we still have a very, very long way to go, Jim. And with respect to schools, it should be lost on no one that no one under 12 years old is vaccinated. And that between 12 and 18, it's a very small percentage who are actually vaccinated. Mm-hmm. And so the idea that you would have kids coming together unmasked in close proximity to one another for 7 hours a day in big numbers, and then leaving and going back out into the community, into homes with grandmothers and grandfathers and parents. I mean, that is an absolute recipe for disaster in terms of increasing transmission, not to mention the fact that we have more young people in the hospital today than ever and suffering more serious disease than ever before because of this Delta variant.
Mary in Lafayette, you're our first caller on show number 64 for Ask the Governor with John Bell Edwards. Hi, Mary.
Hi there. Governor Edwards, first of all, thank you for your steady, firm leadership, not only with this issue, but everything that you do. So I'm a fan. I'm calling to ask about enforcement of masks within transportation terminals. Met a friend within the Lafayette Regional Terminal on a flight coming in from Houston the other night, and 3 males came down the escalator into the terminal area unmasked. Then a party of 6, 3 adults and 3 teens, also were unmasked. I approached a deputy sheriff and was told that he could only ask the people to mask. He couldn't force them to, because your order was only a mandate and not a law.
Yeah, well, first of all, I want to thank Mary for the call. And you all may know this, but the mask mandate was never lifted by TSA. So the federal government kept the mask mandate in for whether it was a bus or a plane and airport terminals, and that was never lifted. And that's actually a federal mandate that applies in that building. And I will tell you that it does have the force and effect of law, and it can be enforced. And in many cases, we know that individuals who work with enforcement agencies are not enforcing it. They are asking and so forth. And quite frankly, they can. If you have someone who steadfastly just refuses, they can issue citations. But what we really need to do is convince people to do what is right for themselves and for their neighbors, and that is to wear a mask. But that one is actually a federal mandate in that airport terminal.
Yeah, and for those of us who have flown, if you flew at any time over the last 17 months, you had to wear a mask, and that
right.
That is now when people would eat at one of the dining establishments or even on the plane, that is relaxed, but you're supposed to put that mask right back on after you've consumed your food.
Correct, and it applies in that terminal as well. But you always have some individuals, and sometimes it's deliberate, and sometimes they're just they make a mistake or whatever. And most people, when they're asked, reminded to put their mask on the way it's supposed to be, they'll do it. Unfortunately, that's not universal, and that's just the world we live in today. And like I said, it's very unfortunate because it causes an unnecessary degree of spread of the virus, and that's why we have the mask mandate in place, is to try to curb transmission.
Cole in New Orleans. Cole, you're on Ask the Governor. Hi, Cole.
Hi. Hi, Governor Edwards, longtime listener, first-time caller. I know that a bill to ban teaching social studies through a lens of race and gender died in the legislature earlier this year, but an update to the state's social studies curriculum was delayed until next month over the same issues. How do you plan to ensure that the same people pushing that misguided legislation don't use this process as an opportunity to reach the same end?
All right.
Yeah, well, first of all, Cole, thank you for the call. I have confidence in Superintendent Brumley and the folks at Bessie to ultimately do the right thing when it comes to the curriculum in our schools, whether it's social studies and so forth. And that was a very controversial bill that Representative Garofalo brought that did not make it out of the committee that he actually chairs. And I know that there's a lot of passion on all sides of this issue, but we just need to educate kids on what is the truth. I mean, history is history, and the fact that much of it is unflattering doesn't mean that it isn't true. And we need to educate kids based on what is real history, and hopefully we will be able to do that going forward. And obviously the amount of academic freedom that I believe we ought to have in higher education for professors is even more than what we have, where we have a prescribed curriculums, for example, in K through 12. But I have a lot of confidence in Superintendent Brumley and the folks at Bessie to get this right, and I hope and pray that they will.
Stephen in Baton Rouge. Stephen, you're on the air with the governor.
How you doing, Governor? I come to you with a heavy heart, and I'm really disgusted, and I listen to everything you said. But now it's my opportunity to say something that's really important. I've lost 3 family members, several people that are actually co-workers, and this is the problem. No ands if about it. You have to make a vaccine mandate, because go back to your interviews 4 or 5 months ago. Go back to interviews about last month. All these people went out, and you told them to go out there and socialize. Both of y'all, everybody's vaccine. There's no way you can separate the vaccine people from unvaccinated people. Governor, we're the highest in the country per capita death rate. Ask Kathleen O'Neill, ask Dr. Cantor. We have to have the mask mandate.
All right, Governor Stevens fired up, and that passion is not unique to him, but your thoughts.
No, and look, first of all, to the extent that he was expressing frustration with the low number of people who are vaccinated in Louisiana, I absolutely share that. Now, it's getting better, and we have every expectation that we're going to add the COVID vaccine to the schedule of mandated vaccinations as soon as the FDA issues a full licensure, full approval, which could come in as early as the next couple of weeks. And immediately when that happens, you're going to see a number of universities that will move to mandate the vaccine. In fact, that's already been approved when that happens. And then we'll start the process to add it to the schedule. Of course, like any other vaccine that's mandated, there will be some opt-out provisions and so forth. But Stephen makes a great point. The vaccines are safe and effective. Today in our hospitals, there are more than 3,000 people. And by the way, that's 10 times as many people as we had on July the 1st, 10 times. And that's the highest number we've ever had is today. 91% of them are unvaccinated. And 90% of all of the cases that we're announcing are unvaccinated individuals. And so trying to get people to embrace the vaccination as the way to protect themselves and their family, but also to do right by their neighbor and curb transmission is really, really important. So the point is not lost on me, Stephen. And as soon we have never in Louisiana added a vaccine, at least to my knowledge, added a vaccine to the schedule of mandated vaccines and prior to FDA authorization. That should come in the next couple of weeks, and we look forward to adding it to the schedule then.
Is it practical to fill Tiger Stadium or almost fill it in 24 days with the situation we have now?
Yeah, well, there's good news there, is that it's outside, and it's always safer than inside. And, is it as safe as if you actually have enough distance between the two people? No, but there are other things that can be done. So whether or not a mask is mandated, people should wear one when they're going in and out of Tiger Stadium and when they're sitting in their seats or whatever in close proximity to others. So there are ways to make that experience safe, and I believe that is going to happen in Tiger Stadium and in the Superdome and in other places. And but I do encourage people to always be mindful. If by age or by comorbid health condition you are more vulnerable to this disease, then you need to take extra precautions. First of all, get vaccinated. Secondly, mask, but then be careful about the groups that you go into and so forth. And that is especially true indoors.
Yvette in Lafayette. Yvette, you're on the air with Governor Edwards.
Hi, this is Yvette. I'm from Lafayette, Louisiana. I'm just curious, will we ever reach a point in order to preserve medical care for the individuals who are getting vaccinated, who are getting the booster? I mean, at what point do the people who choose not to fall behind those who are choosing the right thing?
Yeah, and Yvette, I actually get that question a lot. Not on the radio program. That's the first time I've gotten it on the program. And I can't imagine we're ever going to get to the point where we close the hospitals to individuals who are unvaccinated in order to be able to try to retain capacity for those who are. People are admitted to the hospital or not based on their medical condition, and so I mean we're not going to do that. But Yvette, you make a really good point. If someone is unvaccinated and they do it because they don't trust the vaccines, because they're only being administered pursuant to an emergency use authorization from the FDA, they need to know if they go to the hospital, then they're going to be treated with therapeutics that are also only being administered because of an EUA, an emergency use authorization from the FDA. And so if you're going to trust a doctor to treat you for COVID using something that's under an EUA, trust your doctors when they ask you to get vaccinated so that you don't have to go there. And by the way, it isn't just COVID patients that are at issue here. If a hospital is full, if it doesn't have ICU beds or staffing, then it doesn't matter whether you have COVID or you have a stroke or an automobile accident or a heart attack. And we are seeing large hospitals today. I was on the phone yesterday with hospital CEOs and, medical directors from all over the state. The larger hospitals are not accepting transfers, and so people are having to stay at hospitals that really are not equipped to deal with the severity of their cases. And so this is having an adverse impact on the quality of health care that's being delivered around the state, and not just on COVID, but across the board.
Let's try Susan again. We lost her first go around. Susan in New Orleans, you have the floor. Hi, Susan.
Hi. Hi, Governor Edwards. This is Susan. I'm in New Orleans. And I was listening to you talk about the mask, and I believe in the masks and the testing and the vaccinations. But my daughter is going to LSU, and she's already receiving notifications that her classes are going to be online. And if you look at Dr. Page's reopening, it says that faculty teaching classes with 100 or more may opt for 50% of the students in classroom during peak infection rates. And after 2 weeks of decline, all large classes will resume full capacity. Can you address that?
Well, Susan was asking about LSU, and this is an LSU policy with around in-person instruction where you have, as I understood it, 100 or more students in the class. And during times when you have too much transmission in the community, the professors can, I believe, opt to go to half online and half in person. And that's so that the people who are physically present can actually spread out more, and everybody's going to be masked as well, because that's the policy. And I think that's a recognition that in the age group of 18 to 29-year-olds in Louisiana today, they are responsible for the largest proportion of all new cases, and they also are vaccinated at very low rates. And so while we're making every effort, including the $100 incentive for college students to get vaccinated, they will start school without enough people vaccinated for sure, and with a number of people in that age group who are positive. So I think this is just all a reflection of that and just sort of where we are right now in terms of the overall pandemic.
Grant in Baton Rouge. Grant, you're on the air with, actually, let's go to the next line. Grant, you're on with Governor John Bel Edwards. Hello, Grant.
How you doing? My name's Grant. I'm a student at LSU, and I have a question. So with LSU announcing that once the FDA approves either one of the vaccines or multiple of them I want to know, with LSU allowing that, there's a lot of students who obviously still have questions about the vaccine and they want to keep their individual freedoms of choosing to take it or not take it for their own personal. But LSU has been denying philosophical and religious exemptions for that. What do you have to say about that?
Yeah, well, Grant, first of all, thank you very much for calling. So LSU has already asked the Department of Health for approval that once the FDA grants full licensure of the vaccine to mandate it on its campuses, and that approval has been granted. Now, the mandate, as I understand it, is subject to the same opt-outs that we have currently. And if you opt out of the vaccine, I think that you may be, having to do other things, whether it's masking for longer or testing or whatever. But I can tell you that is a move that LSU is making. And Grant, I would just ask you to take another look at the vaccines for safety and effectiveness. Understand that more than 2.1 million people in Louisiana have had at least one shot, 3.9 million shots altogether. Less than 10 individuals have had a severe reaction to the vaccines, and severe reaction means hospitalization or death, and exactly none of them have died. I think there have been 8 hospitalizations for short periods of time. Today we announced 122 deaths from COVID. So when you look at the relative safety or not of the virus and of the vaccine, it's just not even a close call. And so I would just ask you to take another, and not you, but all the listeners who haven't yet decided to be vaccinated, take another look at them. These vaccinations are safe, they are effective, and they're the best tool that we have to prevent serious disease that causes hospitalizations and death.
And the number of deaths, the latest report in Louisiana, 11,706. And Governor, as you know, that's
Yes.
bigger than most towns in our state.
It's about 4 times bigger than the town I come from, and I do kind of put it in those terms every now and then. I think, okay, the number of people in the hospital today in Louisiana, that's about as many people as live in the town of Amite City. And I just picture every single person that I know and grew up with and so forth, and that just sort of puts it in perspective for me.
877-217-5757. Gideon in New Orleans, you're on the air with Governor Edwards. Hi, Gideon.
Hi. I'm wondering, the governor mentioned earlier that there are people who don't even believe the numbers coming out of the state, and this goes on to include people who don't even believe that the coronavirus is real, believe that it's a hoax. And I'm wondering what the governor plans to be able to do to reach out to those people who are so distrustful of institutions.
Well, first of all, we're never going to give up. We're going to keep talking, and we're going to keep telling the truth. We are extremely transparent. In fact, we were one of the first states to go up with a public-facing dashboard to show people the numbers that we were experiencing. And so we're going to continue to do that. We're going to ask people, look, if you're not going to trust what I'm telling you for some reason, go see your personal physician and ask them what they're seeing in the hospital and whether they can endorse the vaccines and so forth. But the hospital, there are certain things that I call ground truth. The number of cases every day, you may say, okay, yes or no. The number of hospitalizations for COVID and the number of people dying every day with COVID, those are ground truth numbers. And they've never been higher than they are right now. And I will tell you that the daily case numbers that we're reporting, they're accurate. And we have the highest new case rate, the most new cases over a 7-day period of any state in the country. And it's just a function of where we are right now because too few people are vaccinated and because of this Delta variant, which is just so much more easily transmitted. But while we're the worst in the country, you have other states out there that are not far behind us, Mississippi and Arkansas and Florida and others. And quite frankly, I think you're going to continue to see that move around the country because we don't have enough people vaccinated in many, many states yet.
It is a treacherous time, and you're one person. You are the governor of the state, but if you had more surrogates, let's say other statewide elected officials, members of our congressional delegation, many of them are calling for vaccines, but if they were giving a full-throated endorsement collectively, would that help?
It would be helpful. Now, we know from polling of people who are not yet vaccinated, and they give their reasons and so forth, they're really not looking for government leaders right now. If they're going to change their mind, it's going to be on the basis of what a pastor tells them, what their doctor tells them, or whether they have some close family member who prevails upon them to get vaccinated, and whether they actually have close family members and friends who have serious disease or death. Unfortunately, and you can look at the newspapers, you can look at the news any night, and you see that there are all sorts of people going to the hospital and dying, and they're saying, "I just didn't believe it was real. I trusted my own immune system. I didn't think I needed the vaccine. I decided I would take my chances," and they almost universally come around, but in many cases it's too late. You can't get the vaccine once you need to be intubated, right? I mean, it's not going to do you any good at that point. But we do have the ability to listen to people when they're in that circumstance and decide for ourselves that we don't want to be there, and that we can take advantage of these vaccines today. And look, today is a new day. It doesn't matter what you believed or said up until today. Today is a new day. You can change your mind, and you can take advantage of these vaccines. There are more than 1,400 locations in Louisiana today where someone can have access to these vaccines. They're safe, effective, and they are free, and they are convenient on top of that.
877-217-5757. Christy in New Orleans. Do we still have her? Yes. Christy, good afternoon. You're on the air with Governor Edwards. Hi, Christy.
Yes, I would like to know, Governor Edwards, how you sleep at night by cutting off the unemployment for the sake of Louisiana big business lobbyists to keep the minimum wage $7.25 when Jefferson Parish alone is over $17 an hour for just the cost of living.
All right. Governor, I know you've addressed some of those matters, but would you answer Christy?
Sure. So we haven't had a weekly benefit increase in state unemployment benefits in many, many years. I actually think it's been more than a decade. And a compromise piece of legislation came to my desk this year that had the first weekly increase, but it required an early termination of the enhanced federal benefit, the $300 a month, which is going to expire right after Labor Day anyway. And so to accept, in order to grant the increase that is permanent, we believed that it was the right thing to do was to go along with that. And so that's the decision that we made, and that has been explained before on this program and on others.
We have a caller from Lafayette, Hadley. Hadley, you were on Ask the Governor with John Bell Edwards.
Oh, great. Hi, Governor Edwards. It's nice to speak with you. I'm a single mother with an 8-month-old daughter, and I work for a state government agency. Early in the pandemic, we were actually allowed to work from home at no cost to productivity. Now we're back at the office, but with no renewed option to work from home, despite the case numbers rising.
What about working from home?
Yeah, and Hadley, if you haven't disconnected yet, if you make sure that send me the agency that you work for. Obviously, there are some jobs that just cannot be performed from home and some that can. I can tell you that Commissioner of Administration Jay Darden several weeks ago started pushing department heads to ensure that more people were going to be working from home and that maybe they could alternate and have people at home one day and in the office the next, sort of like the situation at LSU that Susan was asked about, just so that you have not the same density of people in a given space in an indoor setting, And so there's some of that that's happening, in fact, much more now than was the case a couple of weeks ago. But Hadley, I'm not able to respond to your specific situation because I don't know which agency you work for and why that might be the case, and it might certainly just be oversight right now. But I'll try to get an answer to you if you'll get that information to the folks there at the radio station, and we'll follow up with you.
Let's go to our friend James in Longview, Texas. James, you're on Ask the Governor.
Yes, good afternoon, Jim. Good afternoon, Governor Edwards. Anyhow, first of all, I just want to thank you, Governor, for honoring a nurse who personally vaccinated more than 2,000 people against COVID-19 in Louisiana. That's an awful lot of people, and I hope it keeps up. My question is, do you think with the intensity of people needing vaccines, I've got mine, but we need to, as Jim put it, put a full-throated approach for more vaccine, and won't be long till maybe a booster shot. Do you think that there'll be enough nurses and other technicians go around pharmacy, other people to inject those people? And then I'm scared of the overflow in hospitals.
Your thoughts, Governor?
Well, first of all, thank you for the call, James. And yes, yesterday we recognized Nurse Carla Brown. She's over 2,000 people that she has personally vaccinated, much of that going door to door. And so she's done tremendous work, and we didn't just honor her, but she was given an honorarium of $25,000 and was allowed to participate in a public service announcement. We don't believe we're going to have a problem administering vaccines. We've got National Guardsmen out there that can do that. You've got clinics and pharmacies and so forth. But the overall nursing shortage is very real. There are 7,000 open positions, employment opportunities for nurses today. We have nurses and other healthcare professionals who are contracting COVID just like the rest of the community, and they're unable to work. We have some that are being hired away by travel nurse agencies because they can work for more money, and they're leaving. And then you have some that are actually saying, look, after a year and a half, I'm just exhausted. And so we have tremendous challenges around nursing. That is the limiting factor in our capacity to deliver life-saving health care to hospitals today. And we have brought in 328 professional healthcare providers, nurses, and so forth to the state. We've got another 353 that are inbound, but some of those 353 will replace some of the 328 that are going to be leaving. But that is nowhere near enough. Jim, we have over 50 hospitals that have asked for staffing assistance, and we're able to help maybe 10 or 12. So the nursing shortage is very, very real, and it's impacting us here just like it's impacting states all around the country.
Claire in Lafayette. Claire, you're on with Governor Edwards.
Hi, Governor Edwards. I know you've addressed unemployment, but I'm very interested for your personal opinion on people like me, I'm getting choked up, that cannot pay their electric bill now because of what you've done. I have applied so many places. I have called, I've gone there, and I'm just getting pushed aside.
All right, Governor, your response.
Well, Claire, one thing I do want to make sure, and I meant to mention this a while ago, and I don't think I did. We do have a program that is well funded that can help with rent and utilities, but you got to put in an application, and if you qualify, they will pay substantial amounts to settle any past due rent amounts, and can even pay forward on rent, but also utilities as well. And it's the lastaterent.com is the website there, lastaterent.com, or you can call 1-877-459-6555 and get connected with that program. And hopefully you'll do that and be able to take advantage of it.
John, thank you, Claire. John in New Iberia. Let's see. We're having trouble picking up John. While we're getting him back in order, let's go to Patrick in Baton Rouge. Patrick, you're on with Governor John Bell Edwards. I think you're going to have to engage the phone line. There we go. Patrick?
Governor, recently in the media I read that you praised yet another extension of the CDC eviction moratorium on property owners from being able to evict for non-payment. renters not paying rent, illegal squatters, which conflicts with the Fifth Amendment right to their due process and taking of their property without just compensation. The CDC moratorium also violates Article 1, the obligation of contracts. How can you, as an attorney and governor that took an oath to the U.S. Constitution, support a CDC order that directly violates the U.S. Constitution?
All right. Governor, would you respond to Patrick, please? Hi, Governor.
And when you have a public health emergency, the last thing you want to do is compound it by having a larger homeless population than is absolutely necessary. And so those moratoriums, which by the way have been in place for a very long time now, under two administrations, and issued by the CDC under both of those administrations, one being President Trump, one being President Biden. It's an easy thing for me to say I don't want any more homeless people than necessary during a public health emergency like this COVID-19 pandemic. And I do understand that we need to do everything we can to make whole the landlords, which is one of the reasons that we have this emergency rental assistance program. And in fact, we have two iterations of it now, the first one and the second one. Both of them are very well funded. And I would encourage any landlords to reach out for help, too, because we always have to verify the applications we get from the tenants with the landlords, and ultimately the money gets paid directly to the landlords. And so we would want them to cooperate with us too, so that we can get that money out and keep people in their homes.
Let's return to New Iberia. And John, you were on the air with Governor Edwards. Hi, John.
Hello? Governor Edwards?
Yes.
Governor Edwards.
He's on with you, John.
Yeah, I can hear you, John.
Oh, I'm sorry. In the statistics for the people that are in the hospital with COVID, it says that 10% are ones that have been completely vaccinated. I would be very interested in finding out, of that 10%, how many profess to have also practiced masking and the social distancing.
Governor?
Yeah, well, I have no way of knowing, because I don't know that question is being asked. In fact, I'm quite certain it's not being asked, and certainly I'm not getting any reports on that information. What I can tell you from my weekly phone calls with medical directors of our largest hospitals across the state, there are a number of individuals who go into the hospital with COVID-19 who say that they are vaccinated when, in fact, they are not. And I guess there are just some people that don't want to own up to the fact that they're there with COVID and they chose not to be vaccinated. And so the percentage of folks in our hospital today with COVID-19 who are unvaccinated is 91%. It might actually be a little bit higher because of the self-attestation that we know on occasion is wrong because the individual's name is not in the link system as having received the vaccination.
Jim and Walker, please be brief. We are short on time. You'll be our final caller for Governor Edwards. Hi, Jim.
Thank you for taking my call, Governor. My question is this. We happen to have a large body of vaccinations that we require for the public health, from meningitis for college students all the way to polio, et cetera, from the beginning of school. And we do that because it's for the public good, it's for the public health. And I'm just curious what happened with COVID, that we have a worldwide deadly pandemic, that suddenly we have lost the political backbone.
There you go, Governor.
Yeah, first of all, you're right. There's lots of them: measles, mumps, rubella, and some diseases have virtually been extinguished, like polio, because of this. Look, I don't know where he was going with the last comment, but what I can tell you is we will add the COVID-19 vaccine to the list of mandated vaccines, that schedule, just as soon as there's full FDA authorization, licensure of it. But I'm encouraging people. I'm appealing to people. Don't wait. Get vaccinated today. I mean, we've got hundreds of millions of doses administered across the country. 2.1 million people here in Louisiana have been administered somewhere around 3.9 million doses. And so there is no reason to wait.